Hello, my name's Chris Murphy, I'm the Director of Physio UK, and I was just going to take 2 minutes to tell you about the Back to Basics Spinal course. I've done a couple of videos for the other Back to Basics courses on the upper limb and the lower limb. And the spinal course follows the structure of the upper limb and the lower limb, such that it starts off looking at the anatomy. And the anatomy is the palpatory anatomy, the functional anatomy. If you're touching on things in an area, you need to know you're on the right structures. So there's time for that. Of course, we do ask that you do some revision before the course, and there is pre-course preparation. And then we go into the subjective examination, and I think in the subjective, certainly for the spine, that's where it's really important you pin it down in terms of good questioning, tight questioning. How do you ask questions? How do you encourage patients to give you the answers that you need? If patients go off, how do you control that situation so that the patient isn't cut off? So the communication gets drawn out a little bit more in the spinal segment than it would do in the other courses. And of course, the advent of yellow flags and of course red flags, which is a theme throughout the courses, but certainly yellow flags. How do you look at the risk factors for chronic low back pain? And of course classification, that's another topic that's gaining a lot more interest, so there's a segment on that too. Stability, the usual things that are banded around in clinical practice currently, so that you have a grasp of those, that you feel confident and you feel competent into when you would use them and when you would choose other methods. So I always say that the days are packed, the spinal is even more packed. So the subjective and then the physical examination, and of course treatment. Treatment's important. Structuring a coherent and competent treatment program is one of the goals that we hope you come out with. And again, that reflects the feedback. People feel that they can do that better afterwards, and they can do that and talk to others about their experiences and about what they would do, and trust in what they're saying. So if you want to improve your handling, if you want to improve your questioning, if you want to improve your thinking, if you want a good revision, and if you want to enjoy the process and not feel silly, then there are 5 key reasons why you should come on the course and why you'll enjoy the Back to Basics Spinal course with Andrea Hemingway. So we hope to see you there, and if you have any questions, then please do email us before. Thanks very much.